Welcome back. We are answering your questions about the coronavirus and the vaccine with Cone Health's Chief Physician Executive, Dr. Bruce Swords. Remember, you can text your questions, 336-379-5775. The number right there at the bottom of your screen. This is text only, though. Do not call. All right, this first question is, I had an appointment canceled. How will I be notified of a new one? And we're specifically talking about with Cone Health.
First of all, I'm sorry that we had to cancel your vaccine appointment. You should be communicated in the same way that you were communicated about the cancellation. And so that might be electronically through your medical record. It might be a phone call to reschedule. One of those two ways really should be in process this week. If that's not the case, you can go to our website, and there's a way to communicate with us about the glitch that's preventing you from making your second vaccine appointment.
This person says, I've heard of second shot reactions. Can you speak to the side effects that you have heard or witnessed?
Sure. The side effects of the second vaccine really can be quite broad. I certainly have had friends, colleagues who have had absolutely no reaction, nothing at all. I have had a close friend and colleague who decided he came to work the following morning after his vaccine. About 3 hours into the day, he decided he'd go home because he felt sort of achy, feverish, and chilled. Probably the most common reaction is really some discomfort at the injection site, and probably more discomfort than a typical flu shot or tetanus vaccine. It really can be somewhat uncomfortable, might disturb your sleep, but other than that, it's perfectly safe. It can't give you the virus that causes COVID-19. So move forward and get your second vaccine.
All right, so we want to be very clear that second shot does not give you COVID-19, even though you might feel that achy, muscly feeling. And is it something where you can take Tylenol or Advil or to relieve that?
Absolutely. So Tylenol, perfectly fine as long as you don't have any reactions to that, and the same with ibuprofen or Advil.
Okay. This person is asking, does Cone Health have a plan to do drive-through mass vaccinations?
We have thought about all sorts of different plans to do large-scale vaccinations. We've considered drive-through vaccine clinics. We might re-explore that. Last week, we were using the Greensboro Coliseum in collaboration with Guilford County, and Cone Health was able to give upwards of 1,500 vaccines in one day. And I believe Guilford County was able to do about the same. So together we were able to vaccinate a lot of people in a short period of time, and we still might go back and explore the possibility of a drive-through vaccine clinic.
This is definitely one of those situations where we learn things as we go, and then we implement certain things as we go. Okay. This person is asking, can I make an appointment for my elderly parents in Guilford County if we live in Rockingham County, if the vaccine becomes available there first?
The short answer is yes. There are ways to make appointments at different county sites, certainly at Cone Health if you are creating an appointment through MyChart. There are multiple different venues, and so keep your eye open, make the appointment as close to your home as possible and as soon as possible, and we'll be happy to vaccinate you wherever you show up.
All right. This person says, if I get the first shot of Pfizer, does the second shot also have to be of Pfizer, or can it be of Moderna?
Yeah, you need to stay with the same company's vaccine for the first and second shot.
This person is asking, if you are on the waiting list, will you receive a call for an appointment?
I won't promise a call. I will promise a communication. And so last week when we were informed that we were not going to get any vaccines from the state this week, we had a waiting list of, I think it was 17,000 people last week, in addition to the 10,400 patients who had appointments this week. So lots of interest in the vaccine, which is great. And once we get to that queue, we'll communicate with you either by phone or email.
This person is asking, are there concerns that there could be a COVID spread at a mass vaccination location?
It's a great question. I said just a few minutes ago that at the Coliseum, in collaboration with Guilford County, we might have vaccinated 3,000 people over a period of time. I will assure you that we are absolutely following the 3 W's at those sites. So everybody is asked to stay 6 feet away from each other unless a couple comes together. Of course, they can stay together. Inside the Coliseum where you're getting vaccinations, seats are well over 6 feet apart. Vaccination stations are well over 6 feet apart. So I think it's very unlikely that someone will have a COVID transmission at our sites. And again, when you go to those sites, show up on time to your appointment, don't show up early, and wear a mask.
All right, we're going to continue taking your text questions. We have one more segment left. The number there at the bottom of the screen, 336-379-5775. We'll be right back.